Hey there, this is Nicole from Kenhub, and welcome to this video tutorial on the anatomy of the hypoglossal nerve. So the hypoglossal nerve is one of the 12 cranial nerves and has one main primary function, which is to do exactly what you see here. Yes, this is the nerve which controls the majority of the muscles in your tongue. So let me first give you an overview of what we'll be discussing today in this video tutorial. And we'll be beginning by first describing the pathway and anatomy of the hypoglossal nerve, taking into account its role in the innervation of the infrahyoid muscles, as well as the innervation of the tongue, including both intrinsic and extrinsic muscles. And finally, we'll conclude with the clinical implications of damage to the hypoglossal nerve. The hypoglossal nerve is the 12th cranial nerve and carries only motor information, meaning that it does not convey sensory information from the tongue back to the brain. And if we look at the name hypoglossal, it can be divided into hypo, which means below, and glossal, which means tongue. So the nerve's role is to innervate the tongue from below. As I mentioned at the beginning of this tutorial, the main function of the hypoglossal nerve is innervation of muscles, which work to change the position and the shape of the tongue. It's therefore involved in the process of mastication and swallowing and the formation of speech or phonation. It's also involved in the innervation of infrahyoid muscles, also known as strap muscles, and these are also involved in speech and swallowing. But let's start with a brief overview of the pathway of the hypoglossal nerve. So in this image, we can see a lateral view of a portion of the head and neck region. And to give you a quick overview, both the left and right nerves originate here in the brainstem. They then pass through the hypoglossal canal, then move inferiorly, anteriorly, and finally superiorly to innervate the muscles of the tongue. So let's break this pathway up and have a look at it step by step for a little bit more detail. The nucleus of the hypoglossal nerve, which we can see here in green, is located in the medulla oblongata of the brainstem at the level of the hypoglossal trigone, which is a slight elevation in the floor of the inferior recess of the fourth ventricle. It then exits the skull through the hypoglossal canal, which is indicated in green right about here when observed from a superior perspective. The hypoglossal canal is a bilateral structure, meaning that there's one on each side, lateral to the foramen magnum, and it gives exclusive passage to the hypoglossal nerve alone, meaning no other blood vessels or nerves pass through the hypoglossal canal. Once outside of the skull, the hypoglossal nerve descends vertically between the internal carotid artery and the internal jugular vein before turning laterally close to the greater cornu of the hyoid bone. Along its course, the hypoglossal nerve then receives a branch from the cervical plexus, and this branch contains fibers from the anterior rami of C1 and C2 spinal nerves, which we can see in this image here. Importantly, these fibers do not combine with the hypoglossal nerve, but just travel within the sheath of the hypoglossal nerve. Think of them as hitching a ride with the hypoglossal nerve to reach their targets, which are the infrahyoid muscles. So let's now have a look at how the combination of these nerve fibers within the hypoglossal nerve are involved in the innervation of the infrahyoid muscles.
This video is not over yet. Continue watching now the full video at kenhub.com. We have lots more videos like this one available to our premium members on our website, not to mention all the fun quizzes, related articles, and atlas sections. So click on the button in the middle to watch the full-length video and master anatomy.